Morning, everyone. Welcome. Welcome to the weekly forum. Fran and all the directors are here. We got a lot of things going on that we're going to tell you about. This COVID-19 issue is not going away. As we all know, as a matter of fact, it's getting worse. So we have to find out, how to keep ourselves safe, working with the staff and working with each other, to keep ourselves safe and find a way to have some more communications within our residents. And Brent and the staff are going to talk to us about that. So let's all work together. Let's hang in there together. It's not going to go away. And we're going to whip it as a team. So with that, I'll turn it over to Brent.
Good morning, everybody. Happy Friday. Today's the 24th of July. We are well into we are in day 48 of phase 2 of Governor DeSantis's plan to reopen Florida. And we're going to start this morning by going directly to the charts. So let's take a look.
All right, we're going to start with a really simple graph. This you can see is for the state of Florida. And the graph looks at 3 different charts, but it's just a really simplistic view that sort of compares this week as opposed to the prior week. And the good news is if you look at the number of new cases in Florida this week, we averaged, 3-day average was 9,776, and that actually is an improvement over the prior week, where we had run 14 consecutive days with new cases in excess of 10,000 per day. If we go to the second chart, this is depicting the number of tests per 1,000 residents, and you can see we're falling a little bit behind. It was more the prior week. Many people will tell you that the more people you have sick or getting infected, the greater the testing. But in order for us to eventually make progress, we're going to have to see a more consistent escalation of this number. Right now, our testing is just not keeping up with the demand. And then the third chart over here is the most disturbing of the charts. You can see that it was up last week, it was up the week before, it is up this week. The number of positive results per test, this dotted black line is the baseline, and you can see we are well in excess of the baseline. CDC says we're looking for about 4.5%, and we're 3 times that easily. All right, this is a graph of Pinellas County, and a couple of things we want to look at. Here's Pinellas County. First thing we're going to do is take a look at the age distribution of the cases. And this is actually some good news here for residents of Regency Oaks. If you look right down in this range, this is 65 to 74, 75 to 84, and 85 plus. And this end of the graph, this spectrum, is actually had a fewer number of reported new cases than the rest of the demographic age groups. You can see the vast majority of the exposures are happening in this 15 to 24 and 25 to 34. And so that's consistent with what we know. It's a younger population who are out and about and socializing and being fully engaged in the community, and that's where the majority of the exposures are occurring. You don't see much of a difference in the demographic makeup of the disease. It's pretty equal in terms of gender. Look at the median age and how this is coming down. You may recall that median age at the beginning was up above 65, and it's already dropped down to 41. All right, let's take a look at the numbers and see where we stand. In the state of Florida, we're up 389,868 cases with 5,518 deaths. That's an increase of just right at 10,000. As we looked at the 3-day average, that's consistent with what we're anticipating. Here in Pinellas County, we are at 14,256 new cases with 364 fatalities. And in Pasco County, the numbers continue to be stable. The United States reached a new benchmark with 4,038,000 cases and 144,000 fatalities. Our testing, we also just looked at this. We're at about 145,000 tests here in Pinellas County, and our infection rate is higher than it needs to be. The hospitalization continues to look pretty well for Pinellas County. We have about 1,200 cases in our specific zip. The numbers are 254 hospitalizations. We have not approached the overwhelming stage of the acute care hospital beds, so our emergency rooms and ICUs across Pinellas County are still able to handle the influx of new cases, which is a really positive thing in terms of responses and the ability to beat COVID. To take a look at our specific numbers here at Regency Oaks, I'm going to turn it over to Leslie.
Good morning, happy Friday. So here at Regency Oaks, under quarantine, we have 20 independent living residents, 9 skilled nursing, and 0 in assisted living. For our staff members, we have 12 in independent living, 8 in skilled nursing, and 1 in assisted living. For COVID flu-like symptoms and testing in progress, we have 1 independent living resident. It's for a planned procedure, so it's no exposures. Assisted living is 0, skilled nursing is 0, and for employees being tested or showing symptoms, we have 5 in independent living, 1 in skilled nursing, and 1 in assisted living. For COVID confirmed cases, we have our 2 past residents that were confirmed and currently 13 employees. For overall testing results, we have our 2 positive residents, but a negative test results of 179. For associates, we have our 13 confirmed, but negatives is 385 testing. Thank you so much. Have a good weekend.
All right, thank you, Leslie. We appreciate that report. So what I'd like to talk about next is sort of the approach that we have been using since the onset of the virus. And Regency Oaks early on adopted a mentality, and what I like to call it is the castle and moat defense. And it's been pretty effective. And essentially what we did is we isolated ourselves in our castle. We took up the drawbridge, we put the alligators in the moat, and we kept everybody out. It's been very effective in keeping us safe, and our numbers look remarkably good, particularly in comparison to other similar CCRC communities across the nation, in the county, and in the state. But this is not a long-term solution, and I wanted to share with you some of the results from a brainstorming session last week that we are going to start the rollout and implementation of. So we're going to go to the board, and we're going to start first with communication. So the challenge that we actually were facing is residents are locked up in their apartments, they're isolated, they're feeling lonely. That confinement to the apartment prevents interactions with people, and it's been going on literally for months. So the goal of our brainstorming exercise last week was, are there ways that we can increase activity, improve the interactions that we have on a daily basis not only resident to resident, but resident and staff. And the first thing that we decided to focus on is to break up the communication that we've been doing over the last 4 months. It's sort of become routine. And so we want to try to expand that and give you something fresh and new. So here is the Channel 732 broadcast for the weeks going forward. On Monday, we will have the traditional COVID update. We'll take a look at what happened over the weekend, how it's impacted us, what the trends are, and what we think the projections are. On Tuesday, we are going to resume our Tuesday talk. This will have some COVID updates. We'll talk about what's happening in the broader sense at the community, look at the various updates with departments and capital and financial issues. It's our more traditional Tuesday talk agenda. On Wednesday, we'll have the housekeeping chat. Jesse will be leading that. On Thursday, Ricky and Phil will come back with our dish talk and menu chat, sort of a combination. And then on Friday, we'll go back to the weekly forum, just like what you're seeing today. So it gives us a little variety. It starts to remove the 24/7 focus away from COVID and back on talking about your daily lives, what's happening in the community, what's changing for you. It gives us a chance to reconnect in person. So all of the Tuesday, Wednesday, Thursday meetings are going to be held in the town hall. We will limit it to 50 to 75 participants. Everyone will be required to wear a mask. There will be appropriate social distancing, and we will broadcast each of the events that afternoon on Channel 732. So I'm looking forward to being able to get back in front of you in person and have the opportunity to take and answer some of your questions and have a dialogue. So I am looking forward to seeing all of you at Tuesday Talk next week. And there are some other exciting things that we want to share with you as well. And to start that off, I'm going to pass it to Phil and our dining services team.
My name's Phil, I'm with Dining, and I just like to get out in front and say, I know that you are bearing with us in the delivery program that we have and being delivered on styrofoam and plastic bags, and it has become a little bit tiresome over these past months. And I just want to let you know that we are working for a solution. We are trying to come up with any way possible for you to get back to a new normal for dining, whether it be open up some venues or anything else. Just a reminder, thank you again for marking what you want and where you want to eat. It is extremely helpful every time you circle what and where you want to eat. Ricky and I are thrilled about being able to come back and have dish talk and menu chat. It is going to be televised this time around, which allows us to reach out to more people at one time, which allows us to get more feedback, which is always important for us. We're also looking forward to the wine club and beer club for those that participate in that as well. Thank you. Wine and beer club, to clarify, will be coming back in August. We will meet up with the chair people and find out exactly when the dates will be. So please look out for the postings. Turn it over to Rance. Thank you.
Good morning, I'm Rance Macy. I'm the healthcare administrator across the street at the health center. Last week we did another round of testing for the residents and the skilled nursing and all the staff that work in the building. I'm happy to announce we had no new positives. Monday will be about 2 weeks since we had our last positive associate, so we're excited about that. I also wanted to let everyone know that CMS has contacted us and let us know that we are going to have access to a rapid testing machine, and I'm expecting it next week, so that will be very useful for us so we can test people that are symptomatic right away. And finally, I just want to announce that Sharon Borak, our long-term medical records and social supply clerk, has announced that she's retiring. Her last day will be Thursday. She's been at the community for almost 30 years. The way she tells the story is they were still building the health center and she applied for a housekeeping job over there and it wasn't even built yet. So if you see Sharon in the hallways at all, say goodbye and good luck. Thank you. And next up is Lauren Rose.
Lauren Rose, Director of Administrative Services. And today I'd like to talk about the proper way of wearing your face mask. So we have a face mask. The colored part is typically the outside part. The white part, which is the filter, goes closest to your face. So if you have this type of mask, you would put it over your nose, behind your ears. There is a metal strip that would be on the top that you could shape to the shape of your nose, and then you pull the bottom down. The only way you're going to protect yourself and others properly is to have your nose covered as well as your mouth covered. So please help us protect you and our staff and wear your masks properly. Thank you. Hear from Jesse Rosalie.
Hello everyone, Jesse Rosalie, your EVS Director. We got some great news. About 2 weeks ago we spoke about the machines, UV ultraviolet machines that were underway here. Well, they're finally here. So we are going to go through a lot of training to understand these machines and properly handle these machines as well. So stay tuned for more information. The process might take about a week or two, but they're great. They're amazing machines. They're very intimidating. So you'll see them around soon. Thank you. Turn it over to Tiffany Rivers.
Good morning, Regency Oaks, and happy Friday. As Brent mentioned, we did have a brainstorming meeting to make sure to bring some more lively things to our community while still social distancing and being safe. We understand the importance of having a good time while still being safe at the community, so we want to really pull back on some of our restrictions while still being safe at the same time. You can look forward to, in the month of August, us bringing back our water aerobics as well as line dancing. We will be speaking with our instructors to make sure they do a temperature check for 5 days before they get back on campus, so just keep a lookout for that. As well as our ice cream socials, those are always a hit and a perfect opportunity for you to cool off with this summer heat. And something you probably, we haven't done in a while, but wing parties. Just an opportunity for you to be able to mix and mingle with our newer residents in a safe environment while social distancing, especially since we have so many new residents on campus. We're really trying to bring our programs back on campus while being safe and healthy all at the same time, but we're not very sure when this might end, so creating a new normal is going to be our main priority at this point. Just keep a lookout for those new dates in the month of August, and we're very excited about that. Please feel free to contact myself or Ginger if you have any questions regarding this. Thank you and happy Friday. And now I'm going to turn it over to Leslie for her update. I just wanted to give out a friendly reminder to residents that we don't want to overcrowd our elevators. So we don't want more than 2 families in each elevator at a time. We'll be putting up signs at each elevator as a reminder. Thank you.
Well, Brant, you know how sociable all the Regency Oaks residents are. I had a great resident ask me, when is the area over the pool and that pool area going to be finished? When that happens, are we going to have any kind of a ribbon cutting ceremony? And with that ribbon cutting ceremony, would there be a chance for some sort of exotic drink that we could have? So that was the lady's question, and I thought I'd pose it to you.
Okay, great question, Don. So this week, the city finally did clear the permit so that the gas line could be installed, and that has been done. So the outdoor kitchen is now fully functional. Ricky, he's a hard guy to keep under control. He already is expanding and building upon the new expansion, and he has ordered a outdoor pizza oven. And so we anticipate that that is going to be installed in the next 2 weeks. So we are looking forward to being able to get out there and celebrate the utilization of the new pool and deck area. I'm hearing a lot of great comments from residents about how attractive it is and how peaceful it is at night to go out and sit underneath the lights and be able to look upward and gaze upon the stars. So that's really good news. Look for us to do a cocktail party out there in the month of August. We are ready to bring back the cocktail parties. We don't have the opportunity to do it indoors, but it seems to me that would be a great location to get out there and have a specialty drink and celebrate the grand opening of the pool and spa.
Some residents asked me if the pergola area was going to have any type of netting or screen or something set up between the wood slats so the sun wouldn't be as strong for residents sitting out there during the daytime, Bran.
So I can share with you that that is a question that we debated extensively in the design phase of the project, and we ultimately decided to leave an open area. We have plenty of outdoor seating that is covered. The breezeway seats 48, the alfresco dining seats another 16. So if you are looking for an opportunity to go out and sit in a shaded area, we have plenty of space available. What the pergola does is it provides comfortable seating with direct outdoor exposure. So our goal was try to encompass both benefits and offer residents the best of both worlds.
Well, as you know, we have some great residents and they have some unique needs. I had a lady who called me and she was requesting stamps. Now the stamps she uses are from the post office and they're the 50 stamp roll with flags on them and stuff. And she was wondering, is there a way that she could get flags? She had to sell her car, so she doesn't have a way to get to the post office. But what's the best way for this lady to get some stamps?
That's a great question, Don. Thank you. We actually have multiple avenues if a resident is needing stamps. On the occasion, you can always stop by the front desk and buy 1 or 2 stamps at a time, or you can use the drivers to go to Publix and buy you a book of stamps. And if in the future, if you ever have questions like that, please feel free to contact me and we'll make sure you get anything that you need of that sort. Thank you.
Brand and all the directors, thank you. This has been a very, very interesting session. I know we have a lot of things happening and a lot more things coming out. And that's all good news. But I want to make a point. Tonight at 6:40 is the first pitch for the Tampa Bay Rays. If you're a baseball fan like I am, this is great news. So we have something going for us now, gang. We got live baseball. So I encourage you to tune in tonight and support your Tampa Bay Rays. Thank you.